Well, thanks for that, Alan. We're going to open up our lines now to see if we have any calls. Anyone who's been watching that wants to ask our two guests a question, please go ahead.
We actually have a question that was submitted through email.
Okay.
It reads, recreational cannabis is scheduled for availability to Canadians in October. When will we know if the government is going to allow pharmacists to dispense medicinal cannabis?
Let me take a stab at this, Justin.
Sure.
You can jump right in. I think the ink is actually still wet on Bill C-45 and its passage through the federal government. It still remains to be seen what the provincial governments are going to want to do in the area of medicinal cannabis and whether or not pharmacies are going to have a role in that. Like Joe said like you said in your introductory comments, it makes absolutely solid common sense for pharmacists to play a role in this. I've had the pleasure of speaking to a number of business groups on the matter of medicinal cannabis and how that's going to be distributed in the province. And everyone seems to be nodding their heads in agreement that pharmacy needs to play a role, and quite simply from a matter of patient care. Integrating medicinal cannabis, treating it like a prescription, that is how it is being positioned, then let's treat it like a prescription. Let's put it onto a patient's medication profile so it can be captured in the reviews, and it can help us to inform providers of an appropriate medication management.
Yeah, absolutely. I agree with all of those comments. I would also add that when we think of the potential public health, public safety risk of patients that are going to potentially self-medicate, we know that there are many different strains of medicinal cannabis, and having the clinical safeguards and the clinical oversight of a pharmacist within that circle of care with access to all the information when it relates to drug-to-drug interactions, contraindications is really critical. We're a low-risk option, and we're the logical, commonsensical option. We've been advocating for a number of years, and there's still a lot of education that's required, especially at the federal government, around the difference between medicinal and recreational. And certainly there is a push to, in Bill C-45, you see a lot of language around pharmacists, and we're trying to figure out what that means and where the gaps are. But I think the momentum is clearly on the side of healthcare providers being involved and helping to mitigate any of the potential challenges that will be related to medicinal. And I think it's important that we educate not only policymakers but patients as well. Sure. Because of the difference in the strains and the complexity of being on multiple medications, having it through a place where we know that 94% of the population trust their pharmacist. And in our polling that we've done collectively and individually, it shows the public opinion support for pharmacies' role in the dispensing and distribution of medicinal cannabis is extremely high. So, you know, with where it's going, and the colleges are starting to, in each of the provinces, and even here in Ontario, the Ontario College released an update on their position with medicinal cannabis. We're trending in the right direction, but I think we need to continue to demonstrate why pharmacies need to be involved, educate on the clinical aspects, and position this as a win for government.
Great. And again, thank you. Our number, if you wish